Okay, so there's a few different variations of burgers. I think he was a popular guy who made a few different exercises. But there is a breathing exercise for burgers, where it is a postural diaphragmatic exercise. So what you're going to do here is you're going to start typically slightly internally rotated, slightly protracted through the chest. And what you're going to do here is you're going to take a deep breath in, initially fill your chest, continue to breathe, then fill your stomach, so fill your diaphragm. And as you do that, you're going to rotate out with the arms, externally rotate until you're getting max inspiration, and then exhale, come back in. This is something you will do, typically anyone who has like any form of labored breathing pattern, any form of like dyskinesia, things like that. You can do this sitting, you can do this standing, you can do this in a kneeling position, whatever people feel more uncomfortable with is what you would want to do it with. Because you'll have individuals who are struggling from a kneeling position, who can't breathe, people who are struggling from more of a supine position, from an elevated position, things like that. But this is a good way to work on diaphragmatic breathing while getting a postural control element involved. So you're working on stretching out pecs, you're working on engaging scapular musculature, you're working on just getting a good breathing pattern. So whether you want to do it more for like, if you want to establish patterns, 2 in, 3 out, 3 in, 2 out, depending on what you're going for. If you want to do whatever number scheme you want to do, you can do that. Or if you're just going for a postural exercise, good. If you're going just for a postural exercise, you would just go for max inhalation, max exhalation, trying to essentially go into as upright as position as possible. That's one variation of a burgers exercise. That is the exercise variation I was talking about, though.
Chris, can we go through maybe a patient example? I think what I tend to struggle with when teaching students is the same thing you said. Like, well, we always do bridges with back patients just because that's
sure.
So we take an example and then kind of go through teaching someone using these exercises what like stability through their core is and how you would progress them from easy to difficult. So
yeah.
This gives me an idea of that.
Sure. So with every patient during your evaluation, if you're doing an evaluation that's useful for you and not just useful for an insurance company, you should be making actual good, realistic goals for that individual. What that means is not just saying like goals you learned in, actually I should say, it is using goals you learned in PT school, just using them in a useful fashion. So if you have a, 55-year-old female who doesn't have anything particular like exciting from like an athletic standpoint, but wants to be able to like go grocery shopping on her own, carry her groceries into her second floor apartment without having back pain. That's a pretty common thing that we would see. You need to break those movements down and make goals that are actually pertaining to what you want to look at. To do that, you might say, so your written goal might say, patient to be able to independently carry 15 pounds bilaterally up 2 flights of stairs with back pain reports less than 1 out of 10. Some standard goal like that. But realistically, you need to break that goal down into more identified patterns. So if you are, Lance, I'm gonna pick on you. Come on out here. Let's say that is our goal, okay? So our goal is 55-year-old woman with back pain. She needs to pick up she's going to have groceries in each hand weighing about 15 pounds in each hand. She needs to go up 2 flights of stairs to get to her apartment. She has to do it without pain. Okay. What is one thing that you need to be able to do to successfully do that? So break down the movement, kind of bring us through the movement, bring us through the pattern of that.
So she needs to be able to have the grip strength and hold it in her hands.
Okay.
She needs to be able to brace to handle that load and be able to ambulate with that load.
Okay.
She needs to change elevation, so being able to go up steps with that, and then endurance to make it up 2 flights of steps with all that involved.
And then go a step further. So to get 15 pounds in each hand, you need to either squat or hinge. You can choose what you want to do. So whether she's doing this versus this, we get into that. She needs to be able to successfully complete that, come up. She needs to be able to successfully carry that for 45, 60 seconds, depending on what you're going for. She needs to be able to successfully set that down as well. Okay, and everything you just described. So what you should be doing is basically breaking those movements down and seeing how well that she's capable of doing it. So honestly, depending on the acuity of the condition, depending on the severity of the condition, it might be as simple as literally saying, here, take this, pick this up, go walk up this flight of stairs, come back down, and just take a look how they're doing. That is going to be realistically the most useful method of determining where your problem is. So let's say we did that. Let's say we gave her 5 pounds in each hand, just initially. And she's like, I'm able to do it, but I feel pain right here every time, or I'll say more accurately, she feels pain right here when she goes down, and when she comes back up, it gets a little bit worse. And then when she's holding the weight, she feels like she's shifting to one side. So she's able to do it, but she has pain, and there's a little bit of dysfunction going side by side. Okay? Knowing that that is her main goal, and taking out the millions of other personal factors that will impact this. So this is I hate hypotheticals more than probably anyone in this room. But let's just say, taking all the other things that may be accounting for her, what are some ways that we can address this starting out, day one? I know there's a million possibles. Teach her how to hinge. Perfect. She said, I feel pain here and here. So why wouldn't you teach her how to hinge? Why would you go straight to a bridge or a clamshell when she just can't hinge? And they might benefit her, but we don't know that yet. So we're going to teach her how to hinge, okay? Let's say we teach her how to hinge. I'm going to see how I can use you to demonstrate this part. Okay, what would be, Lance, if you're teaching somebody how to hinge, what would be your first step for somebody who's never even heard the word hinge before?
I would probably show it to them.
Exactly.
Demonstrate. Like you're taking something, and talk about the goal too. So you're taking something from the ground, hinging at your hip, picking it up, and bringing it up here.
Can you demonstrate a hinge like you would show this 55-year-old woman trying to lift a bag from the ground? We'll use a little 7-pound weight. Okay. Do you want to go from the floor, or do you want to go from elevated surface?
I'll just go from the elevated surface.
Why?
Just because you have it there in front of you.
So what was her goal?
Her goal was grocery bags, so the grocery bag's probably not going to be as low as picking it up off the ground.
So it's also easier to start there and then work down, as opposed to having her. You want to set somebody up for success, especially the first time you do something. Your goal shouldn't be to set them up in a way that they're expecting failure. You want them to have a successful first PT experience. You don't want them to leave with you saying, "Ha ha! I know how to fix all this shit that's wrong with you." They should leave here feeling good about the things that they've done, while also knowing that there's a plan to address the things that they haven't done, that they're not able to do as appropriately yet. Right. So you always want to set them up for success. Okay? So that being said, show me your best hinge.
With explaining or just going for it?
You said you're going to demonstrate.
Okay.
Right? And then go back down. Katie, can you be my 55-year-old woman?
Sure.
He demonstrated, perfect. He demonstrated for you. Can you do it?
Huh?
Do it.
Okay,
Yeah.
got it.
That's exactly what you did. And then go back down. You have any pain?
Yeah.
So you showed her a hinge. She did the hinge. She did the hinge. She has pain. How is her hinge?
It was actually pretty good. Or no, that was not good. Never mind, take that back. So we could correct her hinge pattern, or we could almost show her a squat pattern to get it off the ground too. See it
Okay, you're abandoning the hinge immediately. Immediately abandoning the hinge.
But if you want to stick with the hinge, I like the dowel rod behind the 3 points of contact.
Okay.
Holding there, so I would grab one of these.
I like that. We're just not going to hinge anymore. We're not going to hinge anymore.
You can't do it, you suck.
Really making people feel good the first session. Now you can't do this move anymore.
So we're going to try for 3 points of contact. We're going to try back of your head, kind of the middle of your back, and then your tailbone. And instead of bending more with your back, we're trying to just hinge right at your hip and trying to keep all those points together as you're going down. So I'm going to hold this on your back.
Oh, you're gonna hold it?
I can hold
That's what
it.
you said. Okay.
And then you're going to bend forward, trying to keep those points of contact. So keep your head, come back up,
Travis, this is going to tie into your question in a second.
and then putting your hips back, trying to keep all those points together.
How much acting am I
Coming
doing
down.
here?
Okay.
So she's losing it there. So put it back down a second. We'll try again, okay? So you're just going to start hinging forward slow, and I'm going to tell you when to stop when you start losing points of contact, okay? So stop there. And then you feel you lost a point at your head?
Mm-hmm.
And your back a little bit too?
No, it's there. I feel it.
Is that a southern accent? That was awesome.
Her name is Virginia.
Come back straight and try again, then a little bit more down, then back up. So you feel like you're only bending at your hips there versus kind of bending with your back?
Yeah.
We're going to keep working on that versus trying to bend with your back.
Now, Virginia, when you came back up and you said that you felt pain, okay, were you able to feel anything in your butt, or was it all in the back?
Just in my back.
Okay, so she only felt it in her back. She didn't feel anything at all through the butt. Okay, when he gave you those cues, was it still mostly in the back?
Mm-hmm.
Okay, so she's not getting good activation out of her glute muscles, and most people, unless they have backgrounds in athletics or things like that, do not respond well to squeeze your butt. That is not a cue that means much to a lot of people. Okay, so this is where you might say, let's do an accessory exercise to make sure that you know what that feels like first. Right? So for me, the bridge would tie into a hinge depending on how they feel. A bridge is not a go-to beginner exercise for me unless it ties directly into their lack of functionality in whatever they're doing. Okay? So for Katie, we might say, or excuse me, Virginia, we might say, we're going to do a bridge to emphasize getting that glute activation, because when you come back up, that is exactly what I want you to feel through here, and take some of the pressure off of here. Okay? So that let's say that's the situation right now. All right? So I'm gonna take you off the hook for now. Emily, would you mind, since your legs hurt and you can't do the skipping,
Yeah.
can you show an optimal bridge for Virginia over here to make sure that she gets more gluteal activation over back activation?
You want me to show a bridge?
I want you to get her to do a bridge,
Oh, okay. On the ground?
wherever you prefer.
Virginia, can you get
Can
on
Virginia
the
get
ground?
on and off the ground?
Yes, but I have no issues doing that. Oh,
She's a faker, she's a phony, she's able to get on and off the ground, no problem.
right in the chart.
Can you lay on your back, please? Perfect, and you're gonna bend your knees.
So there's different ways to do a bridge. There's not one bridge to rule them all. There are different ways to do different bridges. We are going for the bridge to emphasize glute activation above all else.
Okay.
Okay?
All right.
That being said, go for it.
This is what I would do.
Sure.
So, I'm gonna have you squeeze your bottom like you're trying to pick up a dollar bill between your cheeks. And when you do that, you're also gonna squeeze your belly and lift up and push up. Back down. Only go till your body is about straight like a board. Good. And squeeze here. Can you feel it in your glutes?
I think so.
Okay. And then back down. What's it feel like?
I don't know.
Does it feel like you're picking something up?
I've never tried to do that.
You've never tried to squeeze your butt together?
Okay, let's say she's getting minimal activation. So we're going to speed her example along just to avoid awkwardness of picking things up with your butt.
Okay.
Let's say that she is getting minimal activation of her glutes, where she's getting it, but she still feels pain, which is typical. She still feels pain in her back, especially when she's at the top of the motion.
Okay.
What are some ways that you can facilitate gluteal activation without? I mean, actually, I'm just going to stop that sentence right there. What are just some ways you can facilitate extra gluteal activation? Because would you send her, let's go back to the question I asked about Kobe. Would you send her home doing bridges like that?
No.
Yeah, correct. I in more foundational exercises, you want to make sure that they're doing them the exact way that you want them to do.
Okay.
So how would you encourage more gluteal activation?
I would use like a band where she can pull apart.
Yeah, exactly. So you can use a band to pull apart a little bit just to get the feeling of that, of like facilitation of the contraction, and then do it. Okay. The other thing is you're going to make sure that she's stopping at the point where she feels the most contraction. For
Okay.
most people, when they're doing a bridge, if you encourage them to go into as much extension as possible initially, not once they're trained, but if you encourage as much extension as possible, this is what you see every single time without fail. I feel it a little bit in my glutes, but otherwise I just feel stretched in my low back. Versus cueing squeezing, going up as high as you can just by squeezing your glutes. This is as high as I can without me putting my hips forward. This is all just pure glutes from there. And then coming back down. I'm not getting full extension through here. This is not, for me, like some people do bridges to encourage optimal or end range hip extension. That's typically not my goal for this, at least, for this variant of bridge. I'm trying to get maximal gluteal contraction. So here, squeeze, come up to the point where you can get the most contraction, and then come back down. If we're just going for that contraction, it might not be a hold. It might just be come up, come back down. Just to essentially feel the top of a hinge movement, and then coming back down. And then when you do a hinge, basically the feeling that you have at the top of that bridge is going to be the exact feeling I want you to have when you're coming up from that hinge. Okay? Make sense? Good. This is just to get them used to feeling gluteal muscle. This isn't a direct correlation to increasing the movement pattern for the hinge, but it does give them some cueing in regards to, okay, this is what it should feel like. Okay. Perfect. Emily, good job. Step out. Lance, teach her a hinge again. So, her homework right now, in regards to being able to, our initial goal of lifting 15 pounds in each hand, walking up 2 flights of stairs, placing it down without pain, okay? We are only on the lifting part. Right now, for her home exercise program, we've established that she's most likely going to have bridges, not just for glute strengthening, but so she can actually facilitate the feeling of activation of those muscles. So that's like exercise number 1 on our program. Because of that, not because it's the exercise that we give everyone who comes in for back pain. Does that make sense? Does that answer your question too, Trev, in terms of like why we're doing it, not just because everybody does it? Like there's a reason, a functional significance behind that.
And then in terms of like sets and reps, is there anything you would change with that since it is more of like
Absolutely.
A movement pattern?
It would be much more based off of feel. So you might do it to fatigue, and by that I don't mean till they're actually done. I mean to the point where they stop getting the maximum height because of their contraction. So if this is where they can get to, and by the time they get to 15 or 16, it's like that, have them stop there. Okay. So I typically stay away from like the 2 sets of 10 or 1 set of 10 for like foundational exercises, just because a lot of it is based more off of motor control and movement patterns.
Right.
You can also set it up from a time-based perspective if you want, but typically you'll do it more to a fatigue type of standpoint.
Makes sense.
Mm-hmm.
So, Virginia, we're gonna try and work on your hinge pattern again. Now that you know where you're supposed to be feeling it, kind of in your hips there, we want to try and make it feel a lot like that bridge. Again, I'm gonna have the pull here. You're gonna try to.
Virginia, get to like 90%.
You can, don't be afraid to put it on my back.
Okay. And then you're gonna go forward and pick up the groceries with a kettlebell.
Now what?
You can put it back down.
Okay.
Do you have pain with that?
Just a little bit, but not as much as before.
So what it looked like to me for Virginia, who did a really good job, she was losing the hinge essentially at the very end and the very beginning of the motion. We're going to skip ahead a couple steps and say it's because she doesn't have the control/mobility, is this both, to control her spine in that range of motion. When we looked at her, she's always grounded. She's going down. That is her self-selected movement pattern. She's very good in flexion. Her natural posture is we're going to pretend like this. She doesn't really like being in extension. Okay? As a result, in order to try to encourage more of a hinge, we can give her some exercises to facilitate a little bit of extension. And for some people, if they have an actual mobility block in extension, this is not a quick fix. For most people, it's more of a motor control perspective, and then you just have to kind of encourage them to go back and forth. So, you have a lot of different exercises to choose from that regards. Let's say we're going to show her cat camel, or cat cow, whatever you want to call it. We're going to show her that with this specific goal of trying to encourage as much extension through the spine, pain-free as possible. So Lauren, would you mind showing her a cat camel with that goal in mind?
I was going to say, wow, you already know the position. So we're going to be on
Virginia's a quick study.
hands and knees. So we want the knees right under the hips, hands right under the shoulders. We're going to let the back sink down as we look up. And then, all right, we'll come back to that, and then we're gonna round this over. Good. All right. Any pain or discomfort with either of those?
No.
Okay. So I'm gonna have you let the back sink down again, and we're assuming it's more like mid-thoracic.
Sure,
That's
we
not-
can, yeah.
Okay. So try to focus on letting this part of the back sink down a little more as we're coming up.
I'm very distracted by Kate fighting Virginia's elbow right now.
Okay. Well, that's a separate issue. So any pain or discomfort as you come down to that bottom point?
A little bit.
Where do you more like a stretch or more pain?
Like pain in my back.
Okay. So and then come back up. I would say if it's more soft tissue or joint restriction.
Okay.
And then go from there.
So you're saying that she's restricted in her lower thoracic spine.
Potentially. It's great.
Ish.
Great flexion through here though.
Yeah, very good. It's amazing. It's a really interesting movement pattern.
It's great.
But she's
Listen,
limited.
it does hurt here. I'm turning into Virginia.
So she has extension intolerance. So she has extension intolerance in her
That's where she
lower
goes.
thoracic spine.
Yeah.
Okay. Do you feel like that exercise will appropriately address that issue?
I would see if it feels the same or gets any better, any worse with a few reps.
Yeah.
And then
So that is an exercise that I said for them to do because that is one thing that typically will help just facilitate that movement pattern. But if she did it and you're saying I feel pain just as you're getting extension and it doesn't look like you're even getting much extension, that would not be the exercise I would go with. Instead of saying you're going to do cat camels, my cat camel is now a movement analysis. So I might say, okay, we need to dive a little bit deeper into this. We might have to do a thoracic mobility exercise. So we might have to do, this could actually be perfectly into a manual technique. We might do a thoracic extension activity. We might see how she does after the manual exercise and then make after the manual technique. If it improves it, then we can give her an exercise that'll facilitate that, okay? So, what I'm gonna do is I'm gonna step in, I'm gonna do a manual technique that I think is going to directly impact her mid to lower thoracic spine. If her movement pattern improves after that, I'm going to give her an exercise that, through my experience, has been shown to correlate pretty well with the manual therapy I'm going to do to see if that improves it. If it does nothing, if I do all manual therapy and it does nothing, that's just as valuable because that means I'm not going to waste my time doing what I just did and we're going to try something else. So it's not just banging your head against the wall over and over again. You want to try it, move on. Maybe once or twice, maybe more than once, but just move on after that, okay? So I'm going to do a manual thoracic extension facilitation technique. Virginia, are you okay being on both your knees?
Sure.
Perfect. Would you mind going down for me? So what I want you to do is you're going to come up nice and tall. Hands are going to go behind your back, or excuse me, behind your head, just like that. And what I want you to do is bring your arms together. And then what I'm going to do is bring you down nice and slowly, so you're going to be just over my arm over here. All right? From there, I'm going to kind of guide you what we're going to do. All right? So we're going to come here. We're going to come down. And I want you to stick your chest out for me. And let me know when you start to feel a little bit of a pull.
Right there.
Good. Where do you feel that?
Right, well.
Where my
right
hand
side,
is?
Yeah, kind of.
Okay. So from here, what we're going to do is we're going to hold this position for a little bit. All right? So I'm going to fast forward a little bit. Typically, I hold this position for like 20, 30 seconds, but for the sake of time, we're just going to go through this. From here, what I want you to do is stay here, push down equally with both elbows into my hand. And then relax. Take a deep breath in, breathe out, and then we're going to come out a little bit more. Feel okay?
Mm-hmm.
Any pain?
Tight.
Okay? So tightness, but no pain.
Mm-hmm.
Perfect. We're going to stay here. 30 seconds have passed. We're going to do it again. I want you to press down. Relax. Take a deep breath in. Breathe out nice and slow. Feel okay?
Mm-hmm.
I'm going to repeat that until we're at her actual end range. Okay? Whether she's telling me I can't go anymore or whether I feel an actual end range. Okay? From there, we're going to hold it. She might do a few sets for the soft tissue release, essentially. So she might press down into me. So press down again. Relax. Press down again. Relax. This is just for this is essentially contract relax, just a little soft tissue release for the lats. Again. Relax. And then we're going to come back up. You will do that whatever you deem necessary. If you do it once, do it a second time and you still get more improvement, do it a third time, see if you get more improvement. I do that until I essentially have no more improvement or if I have no improvement to begin with. Okay? From there, because she was lacking mobility through her thoracic spine when she was doing a hinge, we're going to recheck her hinge. If it improves, we're going to give her a home exercise program, or excuse me, a home exercise that will essentially be the exercise version of what I just did, which is actually what Nick was doing in the back. If not, we're not going to do it. All right? So Lance, she's all yours again.
I think I might ditch the pole now, but we're going to come over to the kettlebell.
Oh, okay.
I was hoping you were going to say, all right, we're going to do a squat now.
And all I'm going to have you do is just,
You just say for the people. Okay.
And then you're going to bend down and pick up the kettlebell. Trying to remember to keep your back tall, feel it in your hips, and bend down and pick it up.
It's amazing.
Nah.
Wow, look at that. It's amazing.
It's all Lance.
Everyone, pat yourself on the back. Good job, everyone. Okay, so in our hypothetical scenario, we gave her bridges to facilitate glute activation because she didn't already had to use her glute. We gave her, we did a manual technique facilitating thoracic extension because we tried to do a cat camel, but it wasn't doing the actual, it wasn't correcting what we wanted to correct. Okay. Because it improved with that, I'm going to give her a manual exercise, exercise to stimulate. Oh my God. We're going to give her an exercise to simulate what I just did from a manual perspective. Okay? So for those of you who saw Nick over there, it's essentially there's different ways to do it. You can get on a stool in the clinic, and at home you can use a computer chair. You're going to have them go in front of a desk. You're going to have them do the same thing that she was doing, essentially over my knee. Get an extension, drop down. Find a point where she feels a little bit of a stretch as she goes back. You're going to press down equally with both elbows. Relax. Go back into it. And you're not just sliding back this way. You're actually pushing yourself forward. Okay? It's not bad to do this, to get a little bit of mild traction through the back, but that is not your goal. Okay? You're trying to get as much extension in the spine as possible. Okay? I would say do that. Again, same rules, same parameters as the manual exercise. Do it to the point where you feel like you're no longer getting improvements. Do it to the point where you're able to comfortably get to your end range. Do it 2 or 3 more times, and then take a break. Okay? In a perfect world, you do it once, and her hinge is perfect. That's never, ever the case. So her home exercise program is now to do bridges for glute activation, to do thoracic extension facilitation, and to do hinges to work on the movement pattern. So out of this whole movement scheme that we just created, where she's going to pick something up, carry it up, where she's going to hinge, pick something up, carry it upstairs, place it back down without pain, by just looking at the picking it up component, we've created 3 exercises for her to effectively do at home with a direct impact on the activity that we're going for. And that is how you create a home exercise program that is appropriate and relevant to what somebody's doing, as opposed to saying, and again, if you do it long enough, like, you know that most people would benefit from X, you know that most people would benefit from Y. That's fine, but there still needs to be a real basis for why you're doing it. It's lazy PT work if you give somebody something because that's what you give everybody. That's what it is. Even if it works, you get lucky. So, does that make sense? Is that a very long-winded way to answer your question about how to?
Yeah, I think that the typical course, like someone coming out of PT school would be like, well, they have back pain. Maybe they have assessed that there's a hypermobility in the lower lumbar spine.
Mm-hmm.
Maybe they have some diagnostic testing that says, oh, stenosis, lower lumbar spine. So we should just strengthen up their core.
Right, and that's what you see all the time. But I mean, we all know that like diagnostic testing doesn't. I mean, don't get me wrong, it's helpful for a lot of things, but it doesn't indicate how you should be treating a patient. It doesn't indicate what you should and shouldn't be doing. If you don't actually see somebody do something, you can't say that they can't do something. Like that's horrible. Like I know that like when I first I have a hernia, and when I first got my hernia, like my surgeon's like, oh yeah, you should not be deadlifting, or you should not be deadlifting. You should not be lifting more than 10 pounds. I was like, what? I was like, I have pain when I do a single leg deadlift with like 140. Like, what are you talking about? Like, I don't have pain doing that. And that to me was, I found a new doctor because that was lazy medicine. It's taking what like should be the case and just not like addressing it in any possible way. So don't tell somebody not to do something until you actually see what they're doing. Yeah. Does that make sense?
Yeah.
Yeah. All right. And then what we would do is, obviously, if that would be session 1, that's fine. That's session 1. They're leaving with 3 exercises, very relevant to their case. More is not better. After they can do those effectively, then you're going to break into the next part of the motion. After they're able to lift it successfully, you might move on to the carry portion. And then you're going to say, they might have no problem doing carries. They might say, oh yeah, once I'm up here, it's fine. And then when they go back down, it might be the same issue, in which that case you might need to work on whatever eccentric strengthening. You might have to work on endurance. Typically, you're going to have to work on endurance from a low and mid back standpoint, especially with more carry-based movements. But that's how you basically build their exercises up. And then after they complete their goal successfully, you revisit everything. You're like, we said you wanted to be able to do this without pain. You did it. And they say, yay! And a lot of times you'll say, like, do you still have pain? And they might say, oh yeah, doing this. But you can at least say, yeah, but you no longer have pain doing that. And most people feel a lot better when you show them evidence of things that they're able to do without pain, as opposed to just like constantly asking somebody, do you feel better? Do you feel better? Do you feel better? Because most people have a very poor memory of how they were doing a week ago, unless they were like, in a wheelchair and then they're walking around. So having good goals like that is really good evidence just to show to somebody to say you are making progress. Or likewise, if they can't do it, you're going to say to yourself, we're not making progress. Why is that? Instead of, I'll see you in 6 weeks and see how the strengthening is going. So, make sense?
Yeah. How much time are we on?
10 minutes.
Let's see.
2:54. 6 minutes.